parents want the best for their children, for them to grow and develop well and to achieve their full potential. Mental health is key to this. Since half of mental disorders begin before the age of 14, it's essential to prevent, detect, and treat them at an early age. But mental health goes beyond the absence of mental disorders. As the World Health Organization says, mental health is a state of mental well-being that enables people to cope with the stresses of life, to realize their abilities, to learn and work well, and to contribute to their communities. Therefore, it is also necessary to ensure our children's well-being and promote healthy mental functioning to enhance the prospects of their future life as adults. Of course, mental health depends on many factors. One such factor, a specific mental capacity of parents called mentalization, can significantly benefit children's mental health. Mentalization can be defined as the brain capacity to be aware of one's own and others' mental states, such as emotions, intentions, desires, and thoughts. Mentalization is a higher-order cognition mostly operationalized through the constructs of reflective functioning and mind-mindedness. However, terms like theory of mind, social cognition, empathy, and emotional intelligence also refer to the capacity to realize the mental states that underpin our behavior. What the term mentalization provides today is a trans-theoretical umbrella concept based on the latest advances in neuroscience. We've used this concept in our review. There's prior evidence that an individual's mentalization and their mental health are associated. What we wondered before starting our review was to what extent mentalization of parents is associated with their children's mental health as a protective factor. Additionally, we wondered if, in the case of parent psychopathology, their mentalization could moderate its transmission to their offspring. Our review analyzed the scientific literature that measured parents' mentalization and their children's mental health outcomes up to the age of 12. After selecting 73 studies, 88% showed significant associations between them across a variety of samples, research procedures, and assessment measures. Almost all of the associations behaved as expected, supporting the statement that children of parents with healthy mentalization skills tend to have better functioning and show less psychopathology. The evidence indicates that parents' healthy mentalization strengthens children's well-being and helps them cope with stressors more effectively, acting as a protective factor against mental health problems. Additionally, almost all of the studies that explored the possibility of a moderating role of parents' mentalization in the transgenerational transmission of psychopathology reported significant effects. In a context where mental health is mostly addressed only once there is a problem, these results suggest that fostering parents' mentalization, not only in clinical, but also in non-clinical settings, could help improve child mental health in terms of symptoms, functioning and well-being, and also stop the growing incidence of mental disorders across development. The positive effects of sensitive parenting on children's development have been extensively observed in the clinical setting. The additional empirical evidence distilled in the scoping review for the specific role of parents' mentalization on child mental health provide additional support for evidence-based practice. Mentalization is a universal cognition, innate to the human brain and therefore present in all people. The evidence for its transdiagnostic and now even transgenerational benefits for child mental health opens a door to stopping the growing incidence of mental disorders, 70% of which start before the age of 18 and 50% before the age of 14. It does so by improving developmental levels of mental health in the general population. This review supports that by strengthening a skill already present in all people, that not only adults' own mental health, but also that of their children in their care could benefit in terms of less symptoms, better social and role functioning, and higher well-being. Thus, children exposed to adults with improved mentalization skills could grow up healthier and more resilient, and achieve adulthood ready to transfer a new level of mental health skills to the next generation, thus perpetuating the positive transgenerational effect. To make this possible, the current conception of mental health, which still recommends intervention mostly once there's a problem, should evolve to the idea that intervening also in non-clinical ranges of the mental health continuum could be even more effective. To promote mental health while children are growing up and before any clinical problem is structured, so as to prevent its evolution, could be one way to curb the current pressure on the public healthcare networks. Parents are present in children's lives throughout all of their development. This review supports the idea that by strengthening parents' mentalization, both in clinical and non-clinical settings, child mental health could be robustly benefited.